Welcome back to the House Healthcare Committee. Sorry about that interruption of the fire alarm. So we're gonna finish section 14 before lunch, and then we will come back to this later. So turning it back over to Jen.
All right, Jen Kirby, Legislative Council. Introduce yourself, Keisha.
Ameren Abergele, Legislative Council.
So Ameren reminded me we did not look or, speak at all about section 13. So section 13 is just the implementation, the timing of the first reports. So the universities would give and institutions would give their first report to the health department by November 1st, and then Agency of Human Services would provide its first legislative report by January 31st. So you'll be able to look at this when you come back.
Okay, and we had some discussion around this section. There is a 5-year sunset built into or not, maybe not a sunset, but a 5-year review.
It's sort of a sunset, but practically speaking, it's a review.
Right, okay.
All right, so section 14.
I'm sorry, just real quick. Any other thoughts or comments on 13, since we kind of left in a quick.
All right.
Okay, go ahead,
Section 14. This is the section on disclosure of protected health information and the prohibition, making it a bit more limited than HIPAA allows for legally protected healthcare activity. So the first thing I did was to add a definition of telehealth, because that term gets used later in the new language. And I just tied it to the same definition that's in the telehealth licensure and registration statutes that this committee worked on last year. So then the bill would prohibit covered entities and business associates, in general, the law, and adding in the business associates shall not disclose protected health information unless the disclosure is permitted under HIPAA. And then we have this new language about protecting patients and providers who engage in legally protected healthcare activities, and limiting disclosure of protected health information related to legally protected healthcare activity for use in certain contexts. And there's a list on page 27 of 5 of these that were in the bills that came over from the Senate. And then there's some proposed additional language adding to subdivision 5 and adding in a new subdivision 6. And these were based on recommendations from OPR and the Board of Medical Practice. So number 5 currently says an exception to this prohibition on disclosure is if the disclosure is to the Board of Medical Practice or OPR in connection with a bona fide investigation in Vermont of a licensed, certified, or registered healthcare provider. And then this would add, or a bona fide investigation of whether an individual who is not licensed, certified, or registered to practice a healthcare profession in Vermont engaged in unauthorized practice in this state, whether in person or through telehealth. And that's where the telehealth definition comes in. And then the second one is if the disclosure is to the Vermont Department of Health or the Vermont Department of Disabilities, Aging, and Independent Living, or both, in connection with a bona fide investigation of a licensed healthcare facility in Vermont, which handles licensing and inspections.
Questions?
I'm just not sure I understand the role of Department of Health and Dale in this context.
So Department of Health and Dale do the licensure and the survey and certification and inspection process for healthcare facilities in the state. And so information may need to be disclosed to them about services that are being delivered in a particular healthcare facility in connection with a bona fide investigation, a real investigation of one of the Vermont licensed healthcare facilities.
So when you say facility, you just mean bricks and mortar, or do you also mean people? Does that include people in an investigation, or just where there are exam tables or whatever?
I to some extent, probably, I think they're related. You've already got the authority for OPR and Board of Medical Practice when they are investigating a licensed healthcare provider, and then that could be related to what kind of practice the person is doing. So, I mean, I think they could go together, or they could be separate.
Thank you.
And this was language that David Hurley, I think when he came in, he said he was putting on his hospital or facility regulator hat, because he's also the person in charge of hospital licensure.
Yep.
I remember him saying that, but now I see the language relating to that.
Yes.
Okay. Okay. There's no other questions on that. So there's been no request to change effective dates. So we'll just go through those when we come back and do the final review. So from what I have written down, we have an outstanding discussion on section 8, finding 1. We have section 9. So for those who missed it, I've asked Daisy to work with Ameren to come up with language suggestions for section 9 that we will review. I gotta check the schedule and see when we're gonna have time, potentially this afternoon or tomorrow. And we'll have a markup then of all the changes, which weren't many, that we made here. And then we'll be close to being able to do a vote. Does that work for everyone?
And typically our practice is to kind of incorporate all of the changes so that what we would be marking up for you in the next draft would be the changes from today's version. Does that work
Yes.
for you?
Yeah, that works. Thank you.
I have a question about the bill, but maybe I can just ask you, Jen, afterwards. It's not a policy
Okay. Yeah.
question. It's about the mechanics of taking a Senate bill and voting on it
Oh, yeah.
in committee. So
That's also yeah, okay. Betsy, and maybe question 2, so. Okay.
I didn't understand your question.
So as the clerk, I had questions about how to complete the record of action form when it's a Senate bill, and are we, so it just.
So it's not, we don't need to worry.
Yeah, let's look at it together. I don't know what the form looks like, but we'll look at it together.
Yeah, and I was gonna say Betsy Ann might be a better person than Jen to
Okay.
walk through that with. So, Jen knows
I
everything.
know, I'm happy to try, but
Knows
yes.
everything, so. I did not mean to insult you, I'm sorry.
She's a really strong woman, that is.
So we will be able to have more conversation. Sorry about the delay there with whatever it was that happened in the building. So sprinkler. So we are going to lunch and then the floor, and we should be back here. Do we have a set time, Claire, or 15 minutes after the floor? 15 minutes after the floor. And we're moving to